And we can go on with the next presentation from the University of Georgia, Mrs. Lela Nadashvili, which is an assistant dean and PBL's tutor lead. And she's a PhD student in medical education of the above-mentioned university. And Lela will present her work under the title E-Program for MD ePBL Students Performance Assessment Recording in David Tvildiani Medical University. Lela, you can.
So, dear Chairman, dear participants, and all guests, I would like to welcome all of you, and I would like to represent today E-Program for MD ePBL Students Performance Assessment Recording in our university. So, efficacious implementation and exploitation of any education program needs joint and established work of different structures of university. And in this view, campus project DTMU MD ePBL program is not an exception in this view. So, moreover, the new program considered implementation of new PBL format of teaching, learning, and assessment. The issue needed to be processed properly in the direction of program administration and provision of education process management. Hence, our goal was to create e-assessment recorder according to the new program worked out in ePBL.net project. It was jointly created by DTMU Dean's Office, Examination Center, and IT Department. In order to create this e-assessment recorder, representative website was created. It was written on PHP, and it uses MySQL database. And also our education program organization structure, schedule, assessment system, PBL assessment, different categories as a part of module final assessment were used for creation of this e-assessment recorder. Before I continue discussion about our e-recorder, I will represent you our modernized curriculum shortly to let you understand why did we have to prepare this e-assessment recorder and what does it express. So in this picture you see the two MD programs of our university. In the upper part of the picture you see the existed previous MD program, and the lower part shows you new modernized ePBL program. The focus for modernization is the first level of learning, which was called Basic Theoretical Medical Sciences, and now it is called Basic Medical and Clinical Sciences. On second and third year, as you see, 30 linear cases and 18 branched cases were embedded, and this was needed to improve the learning process, the teaching process, and it helped to develop quality of gaining the knowledge and clinical skills also. So each year of learning contains 6 modules, and each module is system-based. And as you see from this picture, our students study different systems like cardiovascular, respiratory, digestive nervous system, and etc. On the third year, we added the 6th semester, which is devoted to the life cycle, and students learn life cycle, protection, maintenance, support, life structure, and control. After finishing the third year, our university students take basic medical subject final examination, and after passing successfully this examination, they are transferred to clinical course. So, also, I would like to represent you our PBL week, which is included in each module. And I would like to say that each module contains several subjects which are started with anatomy and histology of human body, and it finishes with clinical diagnosis and clinical assessment. And alongside with other subjects during the week, our students have PBL sessions twice a week, and also once a week they have general clinical experience classes, also biomedical ethics, scientific reading, and other clinical courses. And all this data needed to be expressed in final assessment of students. That's why it was needed to create e-assessment recorder to express all achievements, activities, and everything what students do during the learning process in the final assessment. So, e-recorder has two functions. It expresses assessment in each subject block, and also, according to the pre-quiz points of all subjects, it counts module pre-quiz points and final total score. The recorder is comfortable for practical use because after entering data in everyday assessment recorder, the information is gathered for other recorders also. And as a result of implemented work, created e-assessment recorder enabled following possibilities. After choosing a flow, type, group, module, and subject, access is possible to different windows like everyday assessment recording, quiz assessment recording, and quiz results. Pre-quiz condition of chosen group, module, and subject is represented in everyday assessment recorder, which is represented here. Here also you can see missed hours, recovered hours, activity marks in normal subject, and activity marks in preparation, attitude, and contribution to PBL sessions, and also marks in GCE and other disciplines which are learned in the current module. So, in quiz assessment recording, pre-quiz points of chosen group, module, subject, and quiz results are shown, as well as final mark for this subject. And quiz results assessment recorder shows summative results, which are given for all subjects in the same window, as well as module is summarized and total score is given also. Like you see, the program counts everything, what is given in everyday assessment recorder, and represents it in quiz assessment recorder, according to the corresponding rule, counting rule. So, average of data represented in everyday assessment recorder are represented in percentile as corresponding indices in quiz assessment recorder, as well as program has various corresponding counting rules for different indices. Finally, it sums all pre-quiz assessments as well as quiz marks and gives subject mark in the module. So, why did we need to create this e-recorder? The reasons are following. New PBL teaching format was included in DTMU academic format, and its expression was necessary. Also, fixing attendance achievements in above-mentioned program was needed as well. There was a necessity of expressing PBL achievements in pre-quiz points and counting pre-quiz points in order to express pre-exam assessment in module and subject block. The program has an ability to observe group problems and or progress in different categories of PBL assessment, including working out a supporting plan for students by the tutor. There is a possibility of evaluation analysis of teaching benefits in PBL format, including for quality assurance purpose. In other format, teaching relative to progress for students' achievements analysis on clinical course, in purpose of communication with patients, etc. And program also will allow us to observe academic process per each student and work out improvement plan effectively by saving time with high accuracy. So we can conclude now that e-assessment recording allows for data transmission, synchronization, and storage, and there is possibility for PBL students and or group progress follow-up, including clinical courses. And also there is possibility of comparative analysis for AMD and MD ePBL students, student knowledge in general transport competencies, in field and science competencies, and scientific competencies. So thank you very much for your attention.
Thank you, Lela, for your analytic presentation. Are there any questions for Lela and her presentation? Could I ask you something, Lela? I noticed that the frequency for the assessment recording method was daily. It was per day.
Per day.
Was it difficult for the students? You might thought of frequency per week or something like this?
No, in our students there is a rule that everyday students have to be prepared for the sessions, for everyday assessment of their knowledge. They every day go home, prepare and come to sessions, and they always are prepared, maybe less or more well prepared, but they have to be prepared, and they are got used to work in this manner, and we every day give some assessments and marks for their knowledge. So it's not difficult.
So it's good for you because you have many data then, yes. And the students are very good. Okay, that was very interesting, and the recorder application was very interesting for us, I think. Okay, thank you very much. I think we are on time. Thank you for your presentation.
Thanks,
Lela. Okay.